Well, hi, everybody. My name is Greg Olsen, and I'm the director of the New York State Office for Aging. For those of you that are listening live today, thank you so much for joining us. For those who will be listening in the future, thanks for tuning in. We're really excited to walk you through really our 4-year plan that we are required to provide to the federal government every 4 years. Let me first stop and just do some house cleaning. I want to introduce Sabrina Seeger, who's one of our interpreters. And we also have Jane Hecker-Kane, who will also is one of our interpreters. And I want to thank Colleen Scott from our office for organizing that. As you can see on the top, there's also a way to enable right now your live captions. So for those of you who'd like to view live captions during the stream, you can do so through Google Chrome by going to the settings button, clicking on the 3 dots in the upper right corner of your screen, and in the settings, select accessibility, and a window will open and you can toggle to live captions. When we post this video on Monday morning, along with other resources, and we'll walk you through that a little bit later, closed captioning will already be enabled. So I'll give you guys a second if anybody is doing that before we get started. So before we begin, I would like to thank all the staff at the New York State Office for Aging, not only for helping to put together this plan, but for the work that they do every single day in trying to push the envelope, develop good sound policy and programs, trying to expand those programs to help older New Yorkers and their loved ones remain as independent as possible for as long as possible. I want to thank our network of 59 county offices for the aging, the almost 1,200 community-based organizations, and all the other public-private partners that we have that are in the same space as us trying to improve the lives of older New Yorkers. I'm going to use the term a lot, our network. And what that really refers to is not just NYSOFA, but NYSOFA, our 59 county offices for the aging, and all of the contractors and vendors and community organizations that we work with. Finally, I want to thank you for our communications department, Roger, Alex, and Darren, for putting this production together. It takes a lot of work behind the scenes. So before we begin, let me tell you a little bit about what you're going to see today. Next, please. What this presentation is provided, next please, is designed to do is to provide some context. Who we are, what we do, who we do it for, and what we're planning on doing to help older New Yorkers stay as independent as possible. I do not feel like you can jump right in the middle of what it is that we plan on doing without knowing background and context, the types of services that we already provide, the things that we're planning on addressing in our 4-year plan, and how to actually read the plan and provide input. So the goals of this webinar, as you can see, is an overview of our plan, overview of trends. You have to look at trends over time because we always have to be adept at changing the way we do business to meet future trends. A summary of the major content areas and the direction on how you, the public, organizations, providers can provide input into the things that we're proposing. Next slide, please. So here's the agenda for today, background and context, which I think is critically important. What aging in New York State actually looks like. Not what we think it is, not what we've been told it is, but what it actually is. Our efforts towards building age-friendly communities for people of all ages that help people grow up and grow old successfully. Our first ever statewide needs assessment survey and some of the data that you'll see there, and then how to read and comment on the plan. Next, please. So let's get to some background and context. Next. So what characterizes older adults? This is, I think, important because in the culture that we live in, we often look at older adults through one lens, and that those are individuals that are maybe needy, cost a lot of money to serve, and so on and so forth. But that's not true at all. The growing population obviously is something we're all concerned about, just in terms of how we organize our caring community. Growing older is not the problem. It's how we reorganize our caring community to support people in their community. Older adults are clearly living longer and healthier lives, and their numbers are growing. We've seen over the last 10 years an increase of individuals 60 and over of about 880,000, and the population under 60 has shrunk by about 400,000. This is a population that has enormous variations in health, abilities, financial status, and so on. So you can't think of the older adult through one lens. We have 3 generations of older adults from 60 and beyond, 60, 80, and even past 100. The contributions that older adults bring to our community, socially, economically, intellectually, are really vast. And that's not something normally people talk about, but it's something that we talk about constantly, and we'll talk about that a little bit more as well. Next, please. We know that aging starts when you're born and extends across the lifespan. So many of the things that we're doing at the office, but also Governor Hochul has directed the state to do, is look at how you can pull together a variety of agencies, public-private sector, to build communities that help people grow up and grow old successfully. We know that aging is cumulative. Our educational, financial, and social experiences are all different, which means how we age is going to be different. And it's across the age spectrum. And aging, again, is distinct from disease and decline. While there are some functional or cognitive changes that can happen as a normal process of life, aging does not necessarily mean disability, and it certainly doesn't mean doom and gloom. Next, please. So let's do a level set and talk about who New Yorkers are, okay? We know that we have a lot of healthy older New Yorkers. We have older New Yorkers that have some impairments or chronic conditions, and then we have those who are at risk of, nursing home placement, hospitalizations, et cetera. But let's talk about the contributions first that older adults in the country and then New York State provide. So the 50-plus longevity economy was studies that continue to be updated by the AARP, and this is national data, which really shows that 83% of all the household wealth is held by people over the age of 50. That access to credit, obviously, because of age, and allows them to have a really firm grasp in the marketplace. If you can look at the tax revenue that older adults spend at the county level, the state level, and the national level, it's $1.8 trillion. That'll quadruple by the year 2050 and represents about 40% of all tax revenue generated. Next, please. The 50-plus cohort spends more in all of these areas than their younger counterparts. And this isn't about pitting older adults against younger individuals. It's just we don't often talk about and put data behind the value of this population and how critical they are to family, community, and economy. The 50-plus population are the number one group of volunteers, the number one givers to philanthropy and charity, the number one entrepreneur group, those who are starting new businesses. They have huge donation activities in the United States, and they are a large tourism bloc, keeping our local, state, and national economy running. Next, please. They also support 80 million jobs through their spending. And when you see New York, they are continuing to work, but they're also continuing to support the economy as well. Next, please. So let's look at New York really quick. 50 plus is about 36% of the population, and that's going to grow over time. We'll show you that a little bit later. They contributed 43% or 719 billion in GDP. What's GDP? It's goods and services that are produced directly by people aged 50 and over. They support almost 6 million jobs, and you can see the growth underneath each by 2050. They work and generated 482 billion in wages and salary and contribute about 40% to the local and state tax base, $72 billion. Extraordinarily important. Next, please. You can also look at the state retirement system. 80% gets paid back out to New York communities, 10.6 billion. $47 billion in Social Security payments to older adults come to communities across the state. We have almost 1 million volunteers who contribute 495 million hours of service at an economic value of 13.8 billion. These are individuals that are volunteering in the aging network, providing transportation, delivering meals, preparing meals, working in hospitals, working at polling places, the YMCA, Historical Society, veterans organizations, AARP tax prep, and so much more. We have a large group of older adults that own their own homes. 64% of New Yorkers who own their own homes have no mortgage. If I pulled New York City out of that, that would be 72%. What does that mean? They're supporting the local property tax. They're supporting Medicaid. They're supporting schools, and they're supporting local businesses. And we know that at any given time during the year, there's 4.1 million New Yorkers that are providing some type of uncompensated care to somebody else, a parent, a spouse, a daughter, a disabled individual, and that value of that volunteer service is $39 billion a year. Next, please. So we often talk about health and how important health is, and health care is obviously extraordinarily important. Access to health care, integrating health with other things. But what really makes up good health care are all of the state and local agencies and partners that we all work with in providing transportation to get places, good, enable, and affordable housing, social interaction and participation, civic engagement, community supports, and accessing services. These are the types of things that will determine whether we age successfully or not. And those are the elements of what's called age-friendly communities. Next, please. So as I mentioned, what determines health? Only 10% of healthcare spending has to actually do with a diagnosis. 30% is due to genetics, but 60% is due to our individual behaviors. Do I smoke? Do I eat well? Do I exercise? And the environments that we live in. Are they safe? Is the water clean? Is the air clean? Is my housing safe? Do I have lead paint? Things of that nature. And that's really what we're trying to get at here, is to build those types of infrastructures in the community that help all of us, regardless of age, grow up and grow old in New York successfully. Next, please. You can see from this chart that poor diet and physical inactivity is the number 2 cause of preventable death in New York State in 2015. So the top 3 are all things that we can change. And again, I think that there's solutions to that in trying to provide these types of chronic disease management, social interactions, workforce, the governor's housing plan, and there's so much more so that folks, again, can grow up and grow old successfully in their homes and communities, which is exactly where they want to be, where I want to be, and where most people want to be. Next, please. So why do I outline the 8 domains of age-friendly communities? For a variety of reasons. We've been doing this work collectively with other state agencies and community partners since 2006. But these are the types of things that if you're able to address in building a more connected infrastructure with access to outdoor spaces, buildings that are accessible to older adults and persons with disabilities and children, having access to transportation and housing, being engaged socially in your community, the opportunity to work and be part of civic life, getting the communication and information that you need, and being able to access community services as well as health services. That's going to make the difference. But what you're going to see when you go through our plan is that each of the items that we have in our plan, and we'll walk through that, support many of these domains, and we actually outline them based on domains 1 through 8. So you will actually see those in there, and we'll get to that in a bit. Next, please. So these are many of the services that the Offices for the Aging around the state provide. We have 59 county offices for the aging, 1,200 partners, and many of these services support those 8 domains. They provide community-based services, in-home services that address healthy aging, all the way to individuals that are at imminent risk of Medicaid spend down and nursing home placement. And we know that providing these services are very cost effective. They allow individuals with an array of support services to remain in their homes and communities. And again, that's what we all want for ourselves and for our loved ones, unless our needs change to the point where a higher level of care is required. Next, please. For many of our core services, we do a comprehensive assessment And that's designed to do a couple of things. Many times people interact with our network when they're in crisis, maybe being discharged from a hospital and need a meal, maybe need transportation or a home care aid or what have you. But if we're able to assess based on a variety of different things, like, for example, we assess somebody and find out they're a veteran, we can refer them to our state Division of Veteran Services to access over 115 federal and state local programs. If we screen that somebody is isolated and lonely, we could connect them with community or in-home resources to combat isolation. And there's so much more that we do, because what we really try to do is look at people holistically, give them options, and then allow them to make a decision on what services and would benefit them and their families the most. Next, please. So we're going to take a short break to bring in Jane Heckler-Kane. And thank you so much, Sabrina. We'll see you in a few. So again, background and context is extraordinarily important. As I had mentioned, New York State has been on the path to try to build livable communities going back to 2006. There are two statutory changes that gave the NYSOFA director at that time some powers and duties. One is to develop with the Department of State model zoning and planning guidelines so that you can construct communities that help support people. Zoning and planning is home rule in New York State, and that is developed by the municipalities. The Department of State has continued to update model zoning and planning so that we can provide those types of supports, accessory dwelling units, other types of housing and transportation, mixed use development, et cetera, to help us all grow up and succeed. The State Office for the Aging from 07-09 provided grants to communities for planning on how to build livable communities. In 2010, we had two large statewide conferences on community improvement, smart growth, and livable communities. In 2010, we published a very comprehensive resource directory with the best thinkers, not only in New York State, but across the country, on model planning and zoning, housing, design, transportation, community organizing, and coalition building. Again, with the goal of making communities stronger, more integrated, and helping people grow up and grow old gracefully. Next, please. We became the first age-friendly state in the country in 2017, a designation by AARP and the World Health Organization. And currently there are 32 age-friendly communities that have been designated by AARP, and many, many more who are doing the work but may not have gone through that particular process. Next, please. With the help of the Department of State and the Department of Health and the Health Foundation of Western and Central New York, we put out some grants in 2019 to bring 10 more communities into the age-friendly designation, or to replicate our Executive Order 190 at the county level. Executive Order 190 was a governor's executive order that builds smart growth, livability, and age-friendly principles into state government planning and procurement. And we wanted to replicate that at the county level, so we're all kind of rowing in the same direction. We also stood up 5 age-friendly regional technical centers of excellence that are still operational, and funded a learning collaborative through the New York Academy of Medicine. Next, please. And here's some additional examples. Passed the Complete Streets Act in 2011. Again, I want to thank AARP for all the local work that they did in looking at the safety and walkability of streets all over the state. The state has what's called the Downtown Revitalization Initiative, which provides $10 million to 10 downtowns to change, to build livability principles, housing near services, walkability, access to trails. New York Forward is very similar to downtown revitalization, but it's for smaller areas, rural areas, and smaller municipalities. Governor Hochul, who's been a long-standing supporter of not only our agency, but aging in general, and recognizes that older adults just don't live in the Office for the Aging. They touch many, many agencies and public and private sector entities, proposed a 5-year, $25 billion housing plan to increase the stock of housing in New York by over 800,000 units and so much more. There were 10 regional sustainable development and collaborative governance conferences in 2017. Much of the focus was on age-friendly communities. Next, please. I mentioned Executive Order 190. We are also engaged with the Health Department, with the Healthcare Association of New York State, and many, many others, building age-friendly health systems, working with the Office of Court Administration to build age-friendly court systems, Dementia Friends to teach and educate individuals both that serve older adults but regular community members in signs and symptoms of recognizing and then how you serve or interact with individuals with dementia. And then we became the first state in the country to train our case managers with the National Association of Home Builders Certified Aging in Place Specialists. So when they go in the homes and do home visits with an older adult and potentially their family members or caregivers, they can look at the built environment and provide recommendations on safety features that will allow them to remain in their homes longer. Next, please. I put this up here because I think the public doesn't recognize all the things that go on behind the scenes, not only at the State Office for the Aging, but a lot of the other agencies, and that we actually do work together. And we are not the experts in everything. We are experts in what we do, but there are many, many other experts in different agencies that we work with and leverage. And so I wanted to walk through very briefly just a snapshot of the 31 different interagency councils, committees, and task forces that we sit on and are active contributors for. One is the Most Integrated Setting Coordinating Council, which was started in 2002. And that's really to respond to the Olmstead Supreme Court decision on how individuals with disabilities and older adults can live in the most integrated setting, which is their homes and communities. All of these interagency councils have identified issues, have data behind them, have made recommendations to the state. And these are things that we continue to work on, but can pull into many of the things that we're working on, like the State Master Plan for Aging and all of our age-friendly work. We sit on the New York State Committee for the Coordination of Police Services for Elderly Persons. That's a little bit long, but that's really focused on developing, supporting training to improve law enforcement response to elder abuse and raising awareness. Next, please. We sit on the Interagency Geriatric Mental Health Planning Council. I just lost my slide deck. But what the Geriatric Council does is brings together a variety of state agencies, Office of Mental Health, Department of Health, Office of Substance Abuse, Division of Veteran Services, and the Aging Network to have a holistic approach using grant funding to serving people with physical health, behavioral health, and social needs. We're on the New York State Council Hunger and Food Policy to address access to healthy foods and to address hunger across the age spectrum in New York. We're on the Suicide Prevention Task Force, which again is looking across the age spectrum on how we can reduce suicide in New York State. Next, please. Interagency Task Force on HIV/AIDS, as well as the LGBTQT Task Force to address living with HIV/AIDS and how we can better serve individuals in the LGBTQ community. Obviously, emergencies and emergency management is critically important. We sit on the Division of Homeland Security and Emergency Services planning meetings, and we're on a couple of low-income energy forums that help provide resources to low-income individuals for weatherization, for more energy-efficient appliances, and to lower utility bills. Next, please. We sit on the Coordinating Council for Alzheimer's disease and other dementias to how we can do better to serve, diagnose, screen, identify individuals with dementia, and how we can care for them in the community. The New York State Judicial Committee on Elder Justice, and I want to shout out to Judge Kaplan for all her work, is looking at the court system and how to make that age-friendly. And then we sit on the Office of Prevention of Domestic Violence. Domestic violence is, again, across the age spectrum, and so we need to be a part of that as well. Next. And that's just a snippet. Title V is our workforce program with the Department of Labor. We're a part of that. Tourism Interagency Council and the Governor's Traffic Safety Council. That is not all of them. That's just some. but it's important to point those things out because a lot of times those are things that the public isn't aware that we're a part of, isn't aware is even happening, that state government is looking at specific issues that have risen across the state and are trying to address them with stakeholders and the public-private sector. Next, please. So I want to briefly go through our first ever statewide needs assessment survey that we just completed at the end of March, and we're just beginning to go through. So first of all, a good sample size usually for polling and things like that is between 500 and 2,500. We had 26,000, almost 27,000 responses from New Yorkers. I'm going to ask Alex to stop there for a minute. One of the things I want to point out specifically is that 45% of our respondents were men, and that's very rare in aging. It's usually about 80% women, 20% men, but this is almost a 50-50 on the responses of the 27,000. So we have this broken up. We've got race data, household income data, which is really across the spectrum. Employment status, what people think of their overall physical health, their mental health, et cetera. Next, please. And I'm going to ask Alex to do these in 5-minute or 5-second intervals because you guys can do a deeper dive and we will post this. We're looking at a housing status. What are our household size? How much does it cost? What people think about their communities and their neighborhoods and their opportunities to interact. What their community looks like in terms of serving older adults and overall quality of life. How easy is it to get around? Public transportation, walking, bicycling, etc. Employment and work. Are there opportunities to build your skills if you want to continue to work, or opportunities to get jobs? The affordability of your community and the affordability of housing. So you can do a deeper dive on that. People's responses to whether they're engaged, their recreational opportunities, and how they feel their community responds to that. Their daily activities, are they able to do things like housework and maintain a home and a yard? Are they able to drive? Do they have transportation options from their perspective? Their resource availability. Do they know about resources for older adults? Legal and financial planning, long-term care options, the services in care. Do they know about them? Are they accessing them? Do they fear falling in their home? Have they fallen? Medication affordability, mental wellness, isolation, right? Feeling depressed, feeling bored, feeling lonely, having people in your circle that you can rely on. Personal safety, big deal for everybody. How's the community in terms of crime, frauds and scam, people being abused, feeling like you don't belong, feeling like folks are ageist towards you. Your own community self-engagement. Do you find meaningful work? Do you have meaningful activities? Are you able to connect with recreation and cultural activities, and so on? Civic engagement. What did you actually do over the last 12 months? Voting, none of us will be surprised, 84% of the respondents. But look at the number of individuals that did not participate in a civic group or a public meeting or go to a senior center or a library, etc. So let's talk briefly. Why don't we take a break and we'll bring Jane back in. Thank you, Sabrina. You're still good to go? All right. Okay, so now let's talk about the 4-year plan. Next, please. So the 4-year plan, as I said, is something that we are required to do to meet federal priorities in terms of the funding we get and the policy directions they're really interested in. So you learned a lot about us. You learned a little bit about the services that we provide, the trends and the context that we like to put this behind, and what our goal is. Our goal is to help older adults remain as independent as possible for as long as possible and support the family, friends, and neighbors that may be taking care of them. We also have 350,000 grandparents that are taking care of grandkids. And so that's the overall goal, and that's what the mission is. And we're supported by 59 counties that have the same mission as we do. Next, please. The State Plan on Aging, as I mentioned, is a requirement from the 1965 Older Americans Act. The Older Americans Act is our mothership, so to speak, which enabled the development of state units on aging, which we are all across the country, and the development of area agencies on aging, which we call county offices for the aging across the state. And it requires a public input process. Now, we do a lot to gather information through a variety of mechanisms, but this is one where you can actually go through the plan yourself, and based on what your interests are, can tell us, do we have something wrong? Are we doing things right? What are we missing? What do we need to consider, et cetera? Next, please. So it complies with these sections of the law. It's a requirement in order for us to be funded at the federal level, and it sets up our state requirements for evaluation of the need of services. That's where our needs assessment survey, one piece of data set that will be important, how we will distribute funds, and how effective our services are to provide individuals in the greatest economic need, greatest social need, or disabilities. I want to stop there. Diversity, equity, inclusion is a major focus of the State Office for the Aging, of Governor Hochul, and of the President and the federal government. And we work with a lot of organizations to serve people in geographically dispersed areas, hard to serve communities, non-English speaking communities, and cultural and ethnic minorities. So you'll see that type of language throughout our plan, because it's really important, not just because we're required to do it, but it's the right thing to do. We need to serve those who are most in need, and that's how our funding gets targeted. Next, please. So what the plan does is sets up our requirements on reporting, our fiscal controls, and our fund accounting procedures so that we're a good fiduciary for federal and state dollars, our assurances that we will carry out the long-term care ombudsman program, which we administer. I want to shout out to Claudette and all of her staff for the great work that she and her team and our regional providers provide. Our assurances in the provision of legal services. A lot of folks don't realize we have a legal services program and are required to spend at a minimum 7% of our federal funding on legal services. Our assurance regarding the provision of services for the prevention of abuse of older individuals. We work with a lot of organizations on elder abuse prevention and mitigation. And a shout out to Anne Marie Cook, the whole team at Lifespan, and the entire coalition in New York State for the fantastic work that they do. And assurances on the provision of outreach and education, which is a huge part of our portfolio. Next, please. We're going to move to the bottom of this. Our plan is organized to be consistent with what the federal government is asking us to be consistent with on the priorities that they have. So the plan is going to be organized under 5 basic themes. Older Americans Act core programs that we get funded to provide. And you saw that list earlier of the services that are provided throughout New York State. Many of those are the core programs. They are interested in our COVID-19 recovery as an agency, not only what we did, but what we're going to do in the future for something that may be similar or some other type of emergency, and how we're able to adapt quickly. Advancing equity, that's exactly what I just mentioned, diversity, equity, and inclusion, and access for all populations, but certainly those who are targeted and most in need. Expanding access to home and community-based services. And finally, caregiving. And how we define caregiving is those individuals, family, friends, neighbors, who are providing some level of uncompensated care to somebody else. And we have about 4.1 million in New York State. And they're extraordinarily important because they're the #1 providers of social services in New York. They're the #1 provider of long-term care in New York. And they're a huge part of the healthcare infrastructure in making sure people get to appointments, that are going to dialysis, that understand, wound care when somebody gets released from a hospital, making sure that food's in the house. So they're absolutely critical, and we need to support them in doing their jobs. Do we want to bring? No, she's not here. Okay, so thanks, Sabrina. I appreciate it. We'll keep on keeping on. Alex, next slide, please. Thank you. So there's 4 primary groups of customers that we serve. This is really important. We serve healthy, active, well older adults by providing information, assistance, connection with others, benefits assistance, help with their Plan D, picking their prescription drug plans, helping them get benefits, et cetera, et cetera. That's really important because if people are healthy and are able to stay healthy, then they can continue to be active in their homes and communities. We serve a lot of people that have some type of chronic condition. Could be diabetes, hypertension, et cetera. So we serve 41 of what's called the highest level evidence-based interventions. This means if you provide the intervention the way that it was designed, it's going to improve health and lower costs. And we serve over 36,000 people. Things like chronic disease self-management, diabetes self-management, powerful tools for caregivers. A big part of our business are targeting individuals who are at imminent risk of Medicaid spend down and nursing home placement by providing in-home services such as personal care, helping individuals get out of bed at home, bathe, dress, personal care, shopping assistance, transportation, bill paying, and then, of course, supporting caregivers. Next, please. Our network is focused specifically on who CMS, who oversees Medicare and Medicaid, are really focused on. The top spenders in both Medicare and Medicaid are those individuals with chronic conditions and have functional limitations, like I just mentioned. And you can see that costs $400 billion a year just for the top 5. And the top 20% of Medicare spenders, again, it's chronic conditions and functional limitations. The bulk of the individuals that we serve have more chronic conditions and more functional limitations than these individuals that are the targets of Medicare and Medicaid. And we help them stay in their homes and communities for years with a comprehensive package of services that we provide or our partners provide or other systems provide for very, very low amounts of money. And again, that's where people want to be. But you can see CMS identified the top 4 services are home delivered meals, personal care level 1 and 2, and that's individuals that come in the home and help with bathing and dressing and eating and toileting, shopping, meal preparation, transportation, and chronic disease self-management. All 4 are things that we do every single day. Next, please. This is what our infrastructure looks like. We have 59 county offices for the aging. We have almost 1,200 not-for-profit and other contractors that are helping to provide these services. We have 777 senior centers, over 800 sites where you can get a meal if you're 60 or over, 324 central kitchens that are preparing meals either for the home or a congregate setting. We have 2,384 home delivered meal routes. And I'm going to stop on the meals because we administer with our partners the largest nutrition program in the country, serving 250,000 people and 22 million meals every single year. We have high cap and lit cap counselors and volunteers that are helping individuals with their insurance, their Medicare Part D, or quality of care in nursing homes, and lots of state and local partners to help us leverage additional resources to expand our service ability. Next, please. Here's the strengths of our network. We're already established. We've been around for 50 years. We know who the community are. We know who the community providers are, whether they're within our network or not. We have experience with people going in and out of hospitals and rehab and what is needed in the home when they get back. We have cultural and linguistic competence. We help managed care organizations reduce complaints and grievances. We have the knowledge of the entire community and what their varied needs are and what resources are available. We are trusted. We build relationships. We're mobile. We're in people's homes. We're in the community. Next, please. We serve clients for life, not episodic. It's not uncommon to have people on our caseloads for 10, 15 years or a part of our network, whether it be congregate or volunteering or delivering meals for decades. We have a holistic approach. We're great value. Provide one door for many services through our New York Connects program and through the county offices. We avoid costs, higher levels of care, hospitals, nursing home, Medicaid spend down, improved activations, engagement, that's what that means, and improved satisfaction. And we're mission driven and data informed. Next, please. So the current status is, again, We are primarily under statute required to serve people age 60 and over, both at the federal and state level. That's our requirement. Our portfolio has expanded over the years to include people under 60, like the Long-Term Care Ombudsman Program, our New York Connects systems reform, and our caregiver services. But the bulk of the services that we provide are for individuals 60 and over. We receive about $300 million from federal and state sources, and the counties, municipalities, private fundraising, participant contributions, and cost sharing generate another $325 million. Our network is not an entitlement. What that means is that for some programs, there's eligibility criteria. But even if you are eligible, and because we have fixed funding, the counties and their partners have to budget for the entire year. So it's different from Medicaid, where if you're deemed eligible, or SNAP or HEAP, you can get that benefit, and it can keep growing. Ours is fixed, and so we have to do a really good job of not only leveraging other partnerships, but budgeting throughout the course of the year. Next, please. Here are the folks that we served last year as a network, and I'm not going to run through all of these, but we touched well over 1 million people in the services that I provided, whether it be information and assistance, helping people with their prescription counseling, our New York Connects program, individuals who are receiving meals, those who are receiving nutrition counseling and ed, and on and on. I want to add one bullet. Since the beginning of the pandemic, we have done 80 social media and live shows in-house to connect people to resources, to identify a variety of issues, whether it be screenings, or different benefits, or low and no vision services. We've done 80 of those through our communications department with our staff and other experts around the state, and have reached 670,000 people in about 2 years. So it's a great medium to not only get information out, but to connect people to resources to increase and improve access. And again, educate individuals on what many of the other state agencies do that help support older New Yorkers and their families. Next, please. We rank 4th in the nation with 3.84 million older adults, and that is continuing this demographic to change over time, and it will, and we need to be nimble and change with it. We cannot be serving people in a 1970s model, a 1980s model, or a 1990s model. We need to be in a 2020 model, 2030 model, and 2040 model. And that's really all of our focus here at the state office, is to continuously try to be innovative and expand services the best that we can with many of our partners. Next, please. This is a small slide here, but you'll see the population growth. And what this really shows, again, is the 4.8 million that we had in 2020, and what that's going to look like by 2050. And what you're going to see is a reduction in traditionally white older adults and a huge increase in minority, cultural, ethnic older adults. And we have to respond to that. AARP just put out a report a couple of months ago from the Center of Urban Studies that really highlights many of the cities that are seeing really this unprecedented growth. And not only the State Office for the Aging, but all the offices in New York State, state and local, need to be aware and are of these demographic changes, and it's a priority of the governor. And I think that that's absolutely right. Next, please. This will show you what the composition of the counties is going to look like by 2030. So you look back and you're going to have 36, 46, 52 counties that have at least 25% or more older adults by 2030, and 36 of them over 30%. Now, if you come at the aging lens as a deficits perspective, that older adults are a drain on society, they cost more, they don't give back, then these numbers scare people. But I think we just walked through that. What the problem that we have in this country that the governor and us and many around the nation are trying to change is how we've structured our caring economy, which is right now a reactive system, which waits for people to get sick and wind up in the highest levels of care, like a hospital, like an emergency department, or like a nursing home. And we're not really good at the prevention side. And that's what the governor's really trying to change. here in New York State, and many are across the country, is to balance that out so that we can provide the supports when and if people need them in their community to prevent hospitalizations, ED visits, and nursing home placements. And we know we can do that. So this isn't something to be feared about. Older adults are huge volunteers. They're standing up many organizations. They're still working. Many are going back to work. They can certainly be a solution to the workforce issue we have in this country if they want to go back to work. So there's a lot of pluses to growing older. Next. Chronic conditions are the most preventable and most expensive disabling condition. As you can see, those 65 and older, 35% have a type of disability that's going to cost $864 billion by 2040. We have to have an impact on this because disabilities are things that wind up people being isolated, not being able to get out, not being able to drive, not being able to walk, end up in the ER, end up in the hospital, potentially end up in a skilled facility somewhere. So these are things that we can definitely address. As we address them earlier, from children to middle age, those things are going to have a positive impact on the individual when they get older. Next, please. Sabrina, how you doing? Great, thank you. Next, please. We're going to bring in, okay, sounds great. We're going to bring in Jane. Thank you. There you are. Welcome back, Jane. Next slide for me, Alex. Thank you. So here's the other things you're going to see in the state plan. You're going to see trends. And I want to really thank Steve Sconfienza. He's our demographer and social scientist for, continuously updating on what the reality is for New York State older adults. So you're going to have the economics in there. It's really important to talk about older adults from the positive lens because they're huge contributors to New York State. You're going to see population demographics. You're going to see changes in racial and ethnic diversity. You're going to see migration patterns for New York State, income and poverty, gender, health impairments, growth in long-term care needs, nutritional needs, and community involvement. And there's going to be quite a bit of ink spilled in each of these areas so that, again, you can get a real comprehensive look at what New York State looks like, as well as what we're trying to do to address those issues that we know exist. Next, please. So here's the focus areas. Next slide, please. There's 5 focus areas. One is Older Americans Act core programs. Again, went through some of those. And so they're going to be looking for us to how we coordinate these programs, how we're addressing hunger and malnutrition, how we're preventing, detecting, and assessing abuse, neglect, and financial exploitation, how we're dealing or addressing multidisciplinary team response to elder abuse, age-friendly, dementia-friendly efforts, strengthening, expanding our federal programs, and then how we're improving coordination. Title V is our CSEP program, which is an older worker program. Now, we went through some of this already, and I've repeated that we have a lot to say on all of these issues, and we're looking forward to, again, having you guys go through this plan as well as our federal partners to see that we don't wait to be told that these are the things that we need to be focusing on. These are the things that we identify because we are connected to our counties, we're connected to our providers, we're connected to our older adults, and we hear these things over and over again, and we build them into how we operate as an agency, policy and program-wise. So that's the first focus area. Next, please. The second is COVID-19 recovery. We have a lot to say there as well. And again, remember some of those interagency task forces, right? Hunger and food nutrition, the emergency management task forces. So there's things that we're doing as an agency, but we're also part of a much larger infrastructure of others that have similar, efforts that they're trying to address. So we need to connect the dots on those, and we are. But some of the things that you're not going to see in the plan are work that we're doing with other organizations, both state agencies and the public-private sector. Next, please. Advancing equity, as I mentioned, we talk a lot about that, serving and targeting our dollars to those who are hardest to serve. And we know that the growth of that population is huge. Next, please. Fourth one is expanding access to home and community-based services. We are working to do a lot on this front. And I have to give credit to Governor Hochul for investing in the New York State Office for the Aging. And I have to give credit to the counties and municipalities and faith organizations and community action agencies and others that are working to provide services locally. Where we really need help is from the federal government. They provide the least amount of funding to New York State than any other source. And many of the things, as you can see, that we're addressing are priorities of the federal government that have been put into the Older Americans Act during 15 reauthorizations since 1965. And so we're calling on the federal government to help us out. I want to shout out to Senator Gillibrand, who's really been leading the charge in trying to get our network across the country resourced. And as a matter of fact, on the caregiving front, she introduced a bill yesterday to give Social Security credits to people who are home caring for a loved one. That's a huge deal. Next, please. And then our final one is supporting caregivers, and that is a huge part of our portfolio. So you'll see a lot in there as well. Next, please, Alex. Thank you. So here's the context. This is a first working draft, okay? It is going to be tweaked and amended every day between now and August 1st when it's due. It contains a background and summary information regarding all the demographics, the makeup of the older adult population in the state that I just walked through. It describes the programs and services that we administer. It provides a course of action. It's laid out by objectives. What are our overall objectives? What strategies are we going to take to meet the objectives? And what do we expect to achieve? What are those outcomes that fall under each of our overarching goals? And while this is a comprehensive plan, it's not intended to represent every single thing that we do. It just, you can't do it that way. It's really responding to what the priorities are of the federal government, many of which, all of which actually, and more, we feel the same way about. And it follows the guidelines prescribed by the Administration on Aging and the Administration for Community Living. Next, please. Here's how that's going to be broken up. You're going to see the sections, and the sections follow those 5 broad overarching areas that I just went through. You're going to see under our access services, these programs and services that we provide. You're going to see on our in-home contact and support, these programs. Each one will give a little bit more than a little bit of information about what it is. Most people don't know all the things that we do, how they work, how you can access them, and I understand those reasons. But this will give you guys an opportunity to see the unbelievable work done here at the State Office for Aging, but also all of our partners around the state of New York that we work directly with or partner with. So you'll learn a little bit more about these programs and services. Next, please. Under our core programs, we'll be talking about our Title V workforce programs, civic engagement and volunteering, which is critical to combating isolation, loneliness, and depression. Next, please. We will talk about our nutrition program, our disease prevention and health promotion services. Remember, go back to the chronic diseases, what those will cost, how debilitating they are, but they also are things that can be addressed in the community. We will talk about all our partnerships and work around elder justice, long-term care ombudsman, our legal assistance program, all of our partners and the work that we're all doing to combat, identify, and mitigate elder abuse in all of its forms, including financial exploitation. Next, please. Under Section B, we will walk through all that we did and all that we will continue to plan to do that we learned through COVID to be flexible, to be nimble, and to be innovative. Next, please. Under C, that's the diversity, equity, and inclusion. We'll talk a lot about that, as well as trauma-informed care, which is a focus that ACL wants us to address. So we'll talk a little bit about that. That's a newer concept in terms of the word, but it basically assumes that the people that you're working with in the community have had at some point in their lives trauma, and how those interactions should actually go when you understand and approach people from that lens. Next, please. How we plan on expanding home and community-based services from our private pay program, our unmet need funding, to many of our other partnerships, to things that we're testing to integrate care models with health systems, technology, and others, to work with health providers to contract with us to get paid for services and be able to expand those services. So we'll talk a little bit about that next. And then, of course, all the work that we do in this agency and across the state to support caregivers. Next, please. So here's our overarching goals. Further the vision of the Older Americans Act through leadership and innovations. Enable older New Yorkers to remain in their homes with quality of life for as long as possible. Ensure the rights of older New Yorkers to prevent their abuse, neglect, and exploitation. Empower older New Yorkers to stay active. Next, please. Integrate COVID lessons learned and adaptations to successfully respond to future emergencies. Promote equitable access to older adults in greatest social economic need throughout all of our programs. Support the continuation and growth of state and local policy programs and investments that complement and expand our OAA programs. Continue the work on Age-Friendly New York, which will continue through the governor's leadership on developing our master plan for aging. And then finally, supporting caregivers in the role that they provide and how critical they are to social services, long-term care, and healthcare in New York State. Next, please. Here's how you read the plan. So Monday morning, we will have this video that will be posted that will have text on the bottom for anybody that wasn't able to access that can kind of read what we were talking about today. There's going to be some other resources on there as well. We'll walk through that, but this link will be live Monday morning at 8 a.m. All right, next, please. This is what the landing page looks like, and I'll walk through in a second what you're going to see on there. Next, please. Here's what you're going to find. You're going to find a recording of this webinar with texting on the bottom. You're going to find the PowerPoint separately. So if you want to do a deeper dive of what we just went through, you don't have to listen to the recording. We're going to have a draft of our 2023-27 four-year plan laid out the way I just described it. We are going to have our final 1923 plan, just as a reference if you're interested. This is my fourth four-year plan at the state office, and the changes just over 16 years have been incredible. They should be. We should always be evolving. We should always be looking in the front mirror as well as evaluating in the rearview mirror. We should always be adapting. We should always be innovative and should always be willing to change. So that's just more of a reference point for you. We're going to put in our 21 annual report, which will provide a lot more information on what this office and this network does every single day, because I think it's the best kept secret. And then we're going to have a survey so that you can provide input and feedback on specific objectives, specific programs, specific areas, or if you just want to provide general comments on what's on your mind, what you've seen or experienced personally or through a family or through a friend. We want to hear from you. We hear from providers and lobbyists all the time. I want to hear from people in the community that have a stake in this, which was why the PULCO study, our statewide needs assessment study, that got response back from 27,000 people over the age of 60 is so important. Next, please. So here's how you're going to read it. This is what it's going to look like. Okay, this is an example of one goal. And then you're going to see the objectives that we put under there of what we're going to try to achieve under each one of these program areas and the strategies that we plan on employing to carry those things out. Next, please, Alex. Thank you. Then you're going to see what we plan on measuring, what we plan on doing, and when we plan on doing it, so that it's something that we could take a look at over the next 4 years and see how are we doing. Some things are out of our control. A lot of things are in our control. But our success rate over the last three plans has been 99% success in what we put down on paper. Now, as I mentioned, this is going to constantly be changing based on feedback we get from you, feedback we get from others, feedback we get from the network, our other partners. So this first draft is really, it's comprehensive, but it will change. But we're looking for your opinion on either parts of it or all of it. Next, please. And then finally, this is kind of what the survey is going to look like. This will be going live also Monday morning. It will have what each objective is under those 9 broad goals, and then an opportunity for you to type in a response under each of them or any of them. You can comment on all of it, you can comment on some of it, or you can generally comment through the mailbox that we've opened. But this survey will be available to you as well. Next, please, Alex. Thank you. So providing input, as I mentioned, on any or all of the 8, it's actually 9 overreaching goals. That's my typo. We want you to be as specific on your recommendations as you can. If you're specifically talking about transportation, for example, then put that in there so we can connect the dots on, what's of interest to you and not have to try to generalize. If you can, include the objectives and the strategies that you're commenting on, and provide comments on the existing content as well as any new ideas that you have. There's a lot of innovations going around New York State, and we're aware of a lot of them, but not all of them. And those are great things to share as we continue to work with our other state partners and a variety of other task forces, et cetera, the Master Plan for Aging, to bring these things forward. Feel free to share any of this with anybody that you know on your social media, organizations you work for, older adults you may interact with, volunteers, et cetera. We want to get this out as wide as possible. And I want you to remember that this plan is not designed to be all-inclusive of everything that we do. And each of these programs and services should not be looked at as a separate siloed service. Many of them interact together, and that's how we're able to bring a comprehensive array of supports to older adults for them to choose what matters to them. Next, please. Starting on Monday morning, we are going to be out there in 9 communities to do a similar type of presentation that we're doing right now for individuals to come locally if they want to, again, kind of go through the background, the context, what the plan is, what we do, why we do it, how we do it, and what we're planning on doing. So these are all the locations. You'll see those on the landing page as well. So we hope to see you do that. We did that 4 years ago, and we had really great crowds come out. These are, again, not designed to go through every single facet of the plan. It's already 90-something pages, but to really provide context and background, who we are, why we are, and where we're trying to go, and how you can be involved in our journey with us, because you're the most important. Next, please. Timeline. As mentioned, on May 22nd, that's Monday, the webpage will go live. All of those resources I told you will be listed there. We will be closing down the survey on June 14th. Between now and June 14th, we're going to continue to tweak and edit and add to the plan. So it's a work in progress all the time. After June 14th, we're going to be consolidating and looking at everybody's feedback as soon as they start coming in, and evaluating the things that we may be able to do or things we might need to refer or bring to other task forces that we work on. But we're going to do the internal review, provide edits, and then we are going to provide a draft submission to the Administration for Community Living on July 1. Wait for feedback. Did we hit the mark? What did we miss, et cetera? And then our final submission will go to the federal government on August 1st for approval. Next, please. So I want to thank you very much for joining us today. I know that was a lot. I am a big proponent of background, context, value of the population, value of this network, the way that we need to change our caring economy to support people in their community, and just all the partnerships that we have to try to look in the future, be innovative, and push the limits of our ability within the scope that we can. I want to thank Jane Hecker-Kane and Sabrina Seeger for their interpretation services. Again, want to thank our Communications Bureau of Roger, Alex, and Darren. Want to thank all the staff at the New York State Office for Aging who just do tremendous work day in and day out. the network that we work with, who are the boots on the ground that are supporting older adults and their families every single day. And I just want to say thank you to you for joining us today. And I really hope that you have an opportunity on Monday or before June 15th to take a look at the plan and see what you think and tell us what you think, so that we can, again, not only meet the needs that we know exist, but be educated on things that we might not know. So thank you all for your time today. Again, Greg Olsen, New York State Office for Aging, and we'll see you soon. Thank you.